Okay, thank you for your invitation. First time I would like to excuse my friend and partner Sean Genasia, who can be with us today. I will present the Genasia study regarding 75 patients treated for presbyopia surgery based on accommodation restoration. Today we know many different techniques to compensate presbyopia, but do presbylasik technique compensate presbyopia through monovision, multifocality of depth field, or does residual accommodative capacity play a more important role than we think? Regarding our result and the Genasia experience, because he is himself treated for more than 7 years, we consider that accommodation play a fundamental role. Okay, what is the background of Charles Genasia? He started in 1988 with hair care. He performed also presbylasik centered or decentered, presbylasik guided by aberration, presbylasik guided by asphericity with a wave-light allegretto platform, diffractive and refractive implant surgery, of course, and today the new technology has intracore, supracore, or presbycore. That is our software. Alors, before speaking surgical technique, reminder of new vision principle. What triggers this accommodation? Regarding Tucker and Sherman, the accommodation is triggered by retinal blur plus the sensation of an approaching object that induces stimuli for accommodation, convergence, meiosis to increase of crystalline optical power for the visual acuity, but also for the compensation aberration for the visual quality, a topic not so well documented today. What we know about corneal spherical aberration? The normal corneal present a positive spherical aberration due to a flattening of the peripheral cornea. The peripheral ray, la flèche, elle est the peripheral ray focalized at the front of the retina. In other hand, the internal spherical aberration in a young patient is a negative, and the peripheral ray focalized on the back of the retina. And it's very interesting also to study the aberration with the topographer aberrometer eye tracé. And the exam shows the compensation of the internal spherical aberration and the corneal aberration at the time of accommodation. Because with this aberrometer, you can perform an exam during a reading test. After aberration, we can speak about residual accommodation. On median, talk about residual accommodation, and we know that at 50 years old we have a 2 diopter of residual accommodation. Today, with the OCAS, optical quality analyzer system, we can evaluate this residual accommodation. What is the relation between asphericity and spherical aberration? When you increase in negative corneal asphericity, you decrease the positive spherical corneal aberration, as you see, with the minus 0.73 negative asphericity. Does spherical aberration or asphericity increase the depth field? Regarding Hutchinson, spherical aberration can increase the depth field. What is the depth field? The average value of depth field is 0.30 diopter as reported in several studies, and we only take into account depth field for presbyopia compensation. 0.30 diopter seems insufficient for the near vision. The most important in this surgery is to do bilateral and equivalent surgery without monovision or micromonovision to preserve the principle of fusion and stereoscopic vision and to ensure the best sensitivity contrast, to get the best quality of image and to reuse accommodation. What happens with presbyopia? Beyond the decrease of the accommodative power, we know that the cornea, with a Pablo Ortega study, we know that cornea will flatten with age and induce an imbalance between the internal and cornea aberration. The positive cornea spherical aberration increases with age and is not longer compensated by the negative spherical crystalline aberration, which reduce the accommodative reflex to nothing because the retinal blur is too great. Before to perform the surgery, we have to evaluate different pre-op criteria as pre-op asphericity with a pentacam. To know residual accommodation, it's very important because if patient has no residual accommodation, it's much better to perform a monovision. Know also the cataract index for the patient over 65 years old, and also the distribution of the internal and corneal aberration. In the presbyopia, the positive corneal spherical asphericity increase the retinal blur significantly. The modification of corneal asphericity with Alcon F8 software reduce the corneal aberration and decrease the retinal blur in order to use the residual accommodation. Now, the study on 75 patients, 30 male, 45 female, the age between 45 and 65, spherical equivalent plus 168 diopter, addition average plus 159, accommodation average, very important, plus 69. The protocol was bilateral surgery without monovision and the Q target to minus 80 with wavelight alligator platform. Every patient from this case today has been treated with our own Presbycore software. The result, regarding the asphericity, we can see an increase of the asphericity. This is a target of the surgery to decrease the aberration. Regarding the corneal spherical aberration, we can see also a decrease of this aberration. And regarding the accommodation, all the patients increase our accommodation in 2 diopters. This is very interesting to show now the result regarding the negative internal spherical aberration, which could be in relation to the reactivation of the accommodation, because as you can see, the negative internal spherical aberration increase. And as we see at the beginning for the young patient, we can again find a compensation between the cornea and the internal aberration. The refraction post-op at 12 months was minus 0.35, good for the distant vision. The visual quality after 3 months is good as the pre-op. And now the post-op acuity without correction. You know, 73% of patients as 20/20, 18% patient 16/20, 9% 18/20. Regarding the near vision, it was Jigger 1 for the most of the patient. Conclusion, this technique offers high rate of success. You can perform this technique on the myopia or metropia or hypermetropia patient. The positive spherical corneal aberration modification reduce retinal blur thanks to a more porate cornea. With this new profile of the cornea, the accommodative residual capacity can be reused. This new approach allows us to see how much is important the role of residual accommodation in presbylasik. Hyperporosity does not affect long-term distant vision, and even on young presbyopic patient. And the conclusion, the reestablishment of this accommodation could explain the favorable result obtained with different monogram or different technique to compensate presbyopia. Thank you very much.
Thank you very much. We have a